Hello everybody, I am Dr. Jeena. I am making this video because we are invited for my study which compares online genetic counseling versus in-person genetic counseling in breast cancer patients. I am going to talk about cancer genetic counseling, breast cancer genetics and genetic testing. What is cancer genetic counseling? Cancer genetic counseling is a two-way communication process between a healthcare professional and an individual concerning cancer occurrence and risk in his or her family. Counselor gives information, counseling seeks information. The genetic counselor explains about the nature of the disorder, the consequences, the probability of developing cancer among other family members, and what are the options for management open to them. Human body contains trillions of cells. Each cell contains nucleus. Chromosomes are present inside the nucleus and chromosomes are made of DNA. Functional unit of DNA is the gene. Any change in the DNA message is called mutation. Some mutations are silent and some mutations cause cancer. What is a gene and genetics? A gene is the basic physical and functional unit of heredity. Abnormality in the gene leads to cancer. Human body contains approximately 25,000 genes. Genetics is the study of genes, genetic variant and heredity. In breast cancer genetics, of all the cases of breast cancer, 5 to 10% are hereditary. BRCA1 and BRCA2 are the two most commonly affected genes in hereditary breast cancer. What is the difference between sporadic versus hereditary breast cancer? Sporadic breast cancers are acquired. They are due to somatic mutations, due to carcinogens, due to aging process, or due to chance mistakes during cell division. Hereditary breast cancers are inherited. They are due to germline mutations and they run in the family. They are transmitted from generation to generation. For example, from the grandmother to mother and then to the daughter. So the disease transmitted from one generation to another generation. So they run in the families. Sporadic breast cancers constitutes 85% and hereditary breast cancer constitutes 5 to 10%. A BRCA mutation increases both breast and ovarian cancer risk. So by the age of 50, the breast cancer risk increases up to 50% in BRCA mutation. By the age of 70, the cumulative risk increases up to 70% in BRCA mutation. In case of by the age of 70, the ovarian cancer risk increases by up to 44% in BRCA1 mutation and 27% in BRCA2 mutation. So the lifetime risk of breast cancer in BRCA1 mutation is 55 to 85% and in BRCA2 mutation is 50 to 85%. And the lifetime risk of ovarian cancer in BRCA1 mutation is 35 to 43% in BRCA1 mutation and 13 to 23% in BRCA2 mutation. Who will undergo genetic testing? Breast cancer patient diagnosed at a younger age, less than 45 years, or breast cancer patient diagnosed less than 50 years of age with any close relative with cancer at any age, or male breast cancer patients, or bilateral breast cancer patients, or Ashkenazi Jewish ancestry persons with breast cancer, or any unaffected individual with close blood relative with known genetic mutation. They will undergo genetic testing. The testing process is through blood sample or saliva. Results may be positive for a deleterious mutation, negative for a deleterious mutation, or it may be uninformative, variant of undetermined significance. What to do with the positive mutation? For the patients already diagnosed with breast cancer, so the breast cancer is treated with standard treatment option. For the opposite breast, for the ovary, and for the unaffected individuals, they can be under surveillance or they can be under chemoprevention or they can undergo prophylactic surgeries. In breast, prophylactic mastectomies reduce the cancer risk by more than 90%, and in ovaries, prophylactic oophorectomies reduces the ovarian cancer risk by more than 95%. Breast reconstruction options are also available after risk reduction mastectomies. So the take-home message is, individuals who are susceptible for hereditary breast cancer should undergo genetic testing so that we can prevent the cancer in the future in the individual and in the families. I hope you understood a little about genetic counseling, genetic testing and breast cancer genetics. Thank you.